I'm Janine Giese-Davis. I've been an associate professor of oncology at the University of Calgary, and I've been working to lead survivorship research and a research to program efforts specifically by Linda Carlson in the Enbridge Research Chair for Psychosocial Oncology in the Psychosocial group. A lot of the trouble that we see in the province is that, transferring care to primary care is probably cost effective for the health system, and certainly the cancer system would be pretty overwhelmed to retain all of those women. But the primary care physicians just don't have access to training, aren't trained. And so, although I'm sure that they're quite competent as primary care physicians, understanding what symptoms are really related to the cancer versus related to other things, and what the woman really needs to get back on track and to stay safe and on track and not falling into depression and not feeling abandoned into her cancer care is much more difficult. And so we would want to bridge that gap. And so we had planned this as a 3-time intervention in a year. So the first one would be pretty thorough as a survivor care plan, and we would send the survivor care plan to the primary care physician as well. And then the second 2 times would be really touching base with the person and going through, again, kind of doing a review of systems and seeing how they're doing, but spending much more time in the second 2 contacts with really helping keying in on the things that the woman was struggling to take on and helping empower her to take responsibility for this tremendous communication gap that occurs in the process. If we can train her well enough and empower her, and also simultaneously be feeding information and being available to the primary care physician, we just believe that this could help really bridge that gap. And then, after the first year, maybe the primary care physician would feel more competent and the woman would be, feeling more empowered to take it on. About 75% of all the women with early stage breast cancer are transitioned to primary care. However, we have found that the early stage breast cancer patients, through an interview study, we found that they are experiencing a high symptom burden and are reporting lack of adherence to the follow-up guidelines, and also that they're struggling. They're struggling with adherence, but they're also struggling with like over 50% have not only fatigue, which is normal, but hot flashes and paresthesias and depression and a long list of symptoms. We were actually surprised by the levels of symptom endorsement. So our frontline clinicians came up with this idea to develop a telephone nurse-led intervention over the first year of survivorship. And so we did a study to ask whether in 240 women, whether these women would have used a telephone clinic in that first year, and 71% said that they would have. I guess what we would want professionals to know about early stage breast cancer is, for many, many of these women, they're going to go on and live for at least 5 years and probably 20 years and maybe 30 years. And, they're They have a very good prognosis, most of them. However, that doesn't mean that they're not really needing to adhere to guidelines for prevention, lifestyle guidelines, diet guidelines, exercise diet guidelines. And it doesn't mean just because they're going to live a long time, probably, that they're not wrestling with fear of recurrence and wrestling with depression. We found in the interview study that actually the rural women were far more depressed, endorsing depression far more, and feeling really isolated because there weren't good services. And certainly Cancer Chat Canada has made a big difference in rural settings all across Canada. And yet, you know, you're discharged from your cancer center, you go home to a place 8 hours away from your cancer center in Alberta, and so that's difficult. I think that in Ontario, I know that there's a good survivor care plan available that has had a lot of development and some resources behind it, and that you know, in many of the centers, slightly different models of transition have occurred that have been mostly successful. Alberta is lagging behind in that, and so they endorsed this transition to primary care. But I would have to say to the professionals in Alberta, you know, be mindful that just because somebody's going to survive a long time doesn't mean they're okay.